Hey guys, this is Dr. Rapoff. We're going to do some ECG shorts. Today we're going to talk about PVCs versus PACs and how you differentiate between the two. So a normal conduction pattern starts with the SA node, goes down to the AV node, and then conducts through the Purkinje fibers. So the normal deflection will be kind of in the downward direction for typically most conduction. Now, if you get a PAC, the PAC, atrial contraction, premature atrial contraction, so it comes from somewhere in the atria. So let's say it comes from up here. Well, you have a similar deflecting pattern, so the PAC itself will have a similar appearance. So here's a normal beat, and then here comes the PAC. And you can see they all have the predominant R wave because it's a similar location of conduction. Now, opposite, the PVCs will actually typically come somewhere down in the ventricles, and the ventricles will typically give the PVC a dissimilar deflection pattern to the normal sinus rhythm. So here's a normal beat, here's a normal beat, here comes our PVC. You can see it's predominantly deflection is in the opposite direction of what the normal conduction pattern is. So PACs versus PVCs, typically PACs are narrow complex. They have a similar deflection to the R wave, and they have no full compensatory pause. Opposite, PVCs will be wide complex, opposite deflection, and typically have a full compensatory pause. So here's an example of a PAC, 7th complex right in here. See, the actual P wave is buried somewhere here in this T complex. But it's narrow complex. It comes sooner than the actual normal sinus rhythm would have come, the normal beat would have come, as well as there's no full compensatory pause. And it has a similar deflection pattern to the typical normal QRS complex. So imagine the very top row. These are all beats coming on a specific time. So the second row is our PACs. So we've got normal beat, normal beat, normal beat, and here comes our PAC. Resets the atrial complex, and then we get beats that come dissimilar timing-wise to what the typical beats would have come from the normal sinus rhythm. Now the PVCs, so again, normal beat, here comes our PVC. This actually resets the entire atrial ventricular complex, and it goes right back to what the timing of the previous normal sinus rhythm would have been. So this is what's called our full compensatory pause. It's the distance, basically the distance between two R-to-R intervals. This is our R-to-R interval is the distance between QRS complexes. So if you multiplied the two R-to-R intervals like this, that's the same as this distance right here. Again, full compensatory pause. So here's our PVC. So here's normal beat, here's our PVC. It's wide complex. You'll see this, what's considered a full compensatory pause between the next atrial beat. So this one, we've got a PVC every 3 beats. So what I'm measuring right here is the R-to-R interval. So if we multiplied that by 2, that's 2 R-to-R intervals. That's what the distance between, do a different color, between a lot of black, that would be the distance between here and here. So basically 2 R-to-R intervals get a full compensatory pause. Hope this helps. Look forward to a bunch more ECG shorts, and we're going to do a lot of video shorts.